Disclaimer: this podcast is for educational purposes only and is not medical advice. Always consult with a qualified healthcare professional before starting or changing any treatment, supplement, or peptide therapy. Let's take a deep dive into the world of CJC1295 peptides. This peptide is one of the most talked about growth hormone-releasing hormone analogs, and it has gained popularity among those interested in anti-aging, fitness, and overall wellness. To understand why CJC1295 stands out, we first need to step back and look at what it is designed to do. CJC1295 is a synthetic peptide that acts as a growth hormone-releasing hormone, often abbreviated as GHRH. What that means is it signals the pituitary gland to release more growth hormone. Unlike direct injections of growth hormone, which can sometimes suppress natural production, peptides like CJC1295 encourage your body to use its own system to create a more natural rhythm of hormone release. One of the unique things about CJC1295 is its modification with DAC, which stands for Drug Affinity Complex. This chemical modification extends its half-life dramatically. In simple terms, instead of being broken down and cleared by the body in a few minutes, CJC1295 with DAC can stay active for up to a week. This longer half-life means fewer injections and a more sustained release of growth hormone over time. There is also a version without DAC, simply called CJC1295 without DAC, or sometimes referred to as mod GRF1-29. This shorter-acting version requires more frequent injections, but some people prefer it because it mimics the body's natural pulses more closely. Each has its advantages, and the choice often comes down to individual goals and how someone responds. So, what are the potential benefits of CJC1295? Many people report improved recovery from exercise, increased muscle mass, reduced body fat, better sleep quality, and enhanced energy levels. Some also notice improvements in skin elasticity, reduced wrinkles, and an overall youthful look. That makes sense when you consider that growth hormone plays a major role in tissue repair, metabolism, and cell regeneration. Another benefit worth mentioning is its effect on the immune system. Growth hormone supports immune function, so people using peptides like CJC1295 sometimes notice fewer illnesses or faster recovery from colds. This immune support aspect can be particularly valuable as we age. But what does the science say? Research on CJC1295 has shown that it can significantly increase levels of growth hormone and IGF-1, which is insulin-like growth factor 1. IGF-1 is one of the key downstream messengers that growth hormone triggers, and it is responsible for many of the tissue growth and repair effects. Clinical studies have shown that CJC1295 can raise IGF-1 levels for several days after just one injection. When it comes to dosing, different protocols exist. With DAC, dosing is usually once or twice a week because of its extended half-life. Without DAC, dosing might be daily or even multiple times a day to mimic the natural pulsatile release. Again, dosing strategies are highly individual and should be discussed with a knowledgeable healthcare provider. It is important to understand that while peptides like CJC1295 can be powerful, they are not magic bullets. They work best as part of a healthy lifestyle. That means good nutrition, regular exercise, adequate sleep, and stress management. When combined with these fundamentals, Peptides can amplify results and support long-term wellness. Of course, no discussion of CJC 1295 would be complete without mentioning possible side effects. Some users report mild irritation at the injection site, headaches, or water retention. Rarely, people may experience tingling in the hands and feet, fatigue, or increased hunger. Because growth hormone impacts many systems in the body, long-term or high-dose use could have risks such as insulin resistance. That is why professional guidance is so important. Many people also pair CJC 1295 with another peptide called Ipamorelin. Ipamorelin is a growth hormone-releasing peptide, or GHRP, which stimulates the pituitary in a slightly different way. When used together, CJC 1295 and Ipamorelin can create a synergistic effect, leading to greater and more sustained increases in growth hormone release. This combination is popular because it tends to provide strong benefits while being relatively well tolerated. Beyond fitness and aesthetics, there is growing interest in CJC 1295 for its potential role in anti-aging. As we age, natural growth hormone levels decline, often leading to reduced muscle mass, increased fat, slower recovery, and even changes in mood or cognitive function. By supporting growth hormone release, CJC 1295 may help offset some of these age-related declines. Sleep quality is another interesting angle. Growth hormone is closely tied to deep, restorative sleep. Many people using CJC 1295 report more vivid dreams and better rest. That may be due to the peptide supporting deeper stages of sleep, where growth hormone naturally peaks. Considering how critical sleep is for health, this benefit alone can be quite valuable. Another area of exploration is metabolic health. Some studies and anecdotal reports suggest that CJC 1295 may help improve fat metabolism and insulin sensitivity. That could mean better blood sugar control and a leaner body composition over time. Again, more research is needed, but the early indications are promising. It is also worth noting that peptides like CJC 1295 are still considered research compounds in many places. Regulations can vary depending on where you live. That means quality control and sourcing are critical. Using only trusted suppliers and working with healthcare professionals helps reduce risks and ensures you are getting what you think you are getting. When looking at the big picture, CJC 1295 represents a way of working with the body instead of against it. Rather than forcing unnatural levels of hormones, it gently nudges the pituitary to do what it already knows how to do. This approach can create more balanced and sustainable outcomes. Think of it like tuning an instrument rather than replacing it. By fine-tuning your body's own hormone rhythms, peptides like CJC 1295 may support vitality, resilience, and performance. And because of its extended half-life with DAC, it offers a convenient option for those who prefer fewer injections. Still, peptides are not for everyone. People with certain health conditions, such as active cancer, uncontrolled diabetes, or severe heart disease, may need to avoid growth hormone stimulation. That is why personalization and careful screening are so important. What works beautifully for one person may not be safe or effective for another. As we wrap up, remember that CJC 1295 is just one piece of the peptide landscape. Its ability to boost growth hormone naturally makes it a cornerstone for many protocols, especially when combined with other supportive peptides. But its real value comes when it is integrated into a lifestyle that already prioritizes health. Disclaimer: this podcast is for educational purposes only and does not replace medical guidance. Always consult a qualified healthcare provider before starting or changing any therapy. Thanks for listening, keep learning, and stay curious.